Hi, and this is Dr. Latasha McElwain coming with another quick tips for foundations of addiction and substance use disorder course at GCU. On topic in week 5, topic 5, treating addiction, we talk about the pros and the cons to inpatient stay, and we also talk about outpatient stay as well, the pros and cons of being in an inpatient center or an outpatient center. And with the discussion for that week, the discussion question is asking to provide at least 2 pros and at least 2 cons with rationale to your response. So I'm going to talk a little bit on this first video about the pros and cons of dealing with the excuse me, the outpatient MH, which is mental health, SUD, which is substance use disorder care. So when we start talking about outpatient, considering outpatient care, a lot of times I like to remind students, individuals, and supervisees that providing the assessment, which is number one, the first part of what we do, providing the assessment gives us a chance to decide what's kind of going on with our patient and how we need to consider looking at the treatment plan from the questions that we're asking and the answers that we're getting. A lot of times we do follow up with family to try to get some information as well. When we get to the point of making a diagnosis, after we've utilized our DSM to help make it that diagnosis, as well as maybe even have done a roundabout with our team members to staff the case and make sure that we're on the right track as far as the diagnosis that we've come up to and being able to justify it based on the information out of the DSM, then we are considering outpatient care for this individual. The things with outpatient care, a lot of times we have to consider that outpatient is when a patient is coming back and forth or a client is coming back and forth to the location where they're getting services, meaning if they're getting outpatient therapy services, they may come once a week. If they're getting outpatient substance abuse individual therapy, they might be coming once a week. They could possibly be coming twice a week if they're getting a little bit more, if they need a little bit more intense care, but not necessarily falling under the intensive outpatient services. They may come twice a week, but once they get to 3 times a week, then we're looking at that person being in more of an intensive outpatient program per se. Substance abuse, there is definitely a setup per se where it comes down to programming for outpatient. Mental health, that would probably be a programming that an individual clinician or agency might end up coming up with to support. But with those intensive outpatient services, the person will be coming back and forth. They're able to go to work on a daily basis. They're able to maintain their lives. They're able to have personal lives, go home, sleep every night. They're able to, like I said, come in and out for care. There are pros to that and there are cons to that. Pros are you're able to keep your job. You're able to try to maintain as normal of a life as possible when you're doing outpatient services. You're able to meet with your, let's say, outpatient therapist, outpatient med management. You're able to meet with your maybe Suboxone clinic. All these are on an outpatient basis. And with that being said, you're able to focus on still maintaining your life while you're getting your treatment in. Some of the, I guess, downfalls you would say is the fact that you are still maintaining your life. How effective maybe is the treatment because you still have all these stressors or minor stressors or different things happening in your life and going on around you where, yes, you are getting your treatment, but are you really able to totally focus on it with everything still going on? Some people will call it a pro, some people will call it a con, but in a lot of different instances, you have individuals that realize that they are equipped to do just that, as in being in the outpatient setting. And then you have individuals that realize that they're not equipped to do just that, and they probably would need an inpatient or a more residential type setting where they're actually spending the night, involving themselves in that atmosphere and being on site without other distractions being in place. So again, if you're in outpatient therapy, you'll be able to catch a movie on Friday night, and able to go sit and have dinner with your friends or, with your family or whatever. If you're an inpatient, then you're not leaving the facility to go have dinner Friday night and, have a movie as well. So the outpatient services is helpful for a lot of times when students are in school. It's very helpful for our adolescent and our younger children population. A lot of times outpatient will definitely help a person to maintain, quote unquote, their normalcy in the community, but still taking the time to take care of themselves as far as getting those outpatient sessions in on a weekly basis. Like I said, again, some of them could become twice a week, or it could also become to be 3 times a week if it's more of an intensive type program. Some other programs in my state, North Carolina, are kind of like your intensive in-home outpatient type services where you have someone coming into your home 3 to 5 days a week, and that is a service as well. And that's mainly with children. Our CST program, our community support services program, a community support teams programs here also are programs like that that are for the adults. And that includes getting a lot of information, getting on-site, in-home, in the community type therapy, and being able to tell them about different resources and different avenues and different things that they can be doing in the community as well to kind of keep a normal functioning life, basically keeping an individual in the least restrictive environment possible that they can get the care they need. So that's talking all about being in an outpatient setting. And I think being in an outpatient setting also, a lot of people find it to be more manageable for maintaining, again, like I said, their life. The other thing too is, which I think is a pro when it comes down, for me, it's a pro when it comes down to outpatient. Outpatient therapy would be able to, a person, yes, able to maintain their life, but then they don't have to worry about trying to become integrated into society again, because they're still in society and they're still stepping out and doing their own, individual therapy or group therapy or whatever the case may be on a regular basis. So that's always something great to think about when we're talking about outpatient services. Again, for outpatient services, again, we're just really trying to look at the fact that, individuals are able to get the service that they need and be able to work from a standpoint of definitely being on point with keeping up and doing everything they need to do in society and do for themselves. So some of the outpatient limitations, again, like I said, there is less 24-hour-a-day focus when it comes to outpatient limitations. Also, when it comes to outpatient limitations, you can look at the fact that some individuals, like I said, the way people, it could go down to people's learning styles. That could also be, a concern where a person being more involved or being kind of integrated into the society of treatment, that could cause a concern for individuals who have to be kind of all in when it comes down to getting their therapeutic services. So there are so many other limitations to being in outpatient therapy that jogs us into the reason why being in inpatient therapy. So with that being said, like I said, topic 5 in your discussion questions. It's going to talk a little bit. It's going to have questions around inpatient and outpatient therapy. This is just a recap of the weekly discussion and some critical thinking areas that I want you guys to be able to consider and think of when you're in this class and as you're working through a lot of the discussions for week 5 and other weeks as well. So you'll definitely see more videos and audios regarding other discussion topics also. Again, this is for the Grand Canyon University course is Foundations of Addiction and Substance Use Disorder. Again, that's Foundations of Addiction and Substance Use Disorder. And this is topic for week 5. This is dealing with a discussion question. The topic for week 5 is talking about the treating of addictions. And you have a couple of discussion questions again. And so this right here is just a little snippet so that you guys can have something to go on. Thanks so much, and I hope you have an eventful day.